Materia Medica, that is Agaricus muscarius. So, during your day-to-day consultation, you may say that patients who have dropped things again and again, reaches too far while picking the objects, walk awkwardly as if drunk, has twitching eyelids, face, tongue, and all day together. So, if you what if you I tell you that this is not a weakness, this is not a paralysis, this is a disordered control of movement, that is loss of control of movements. So when movements are exaggerated, uncertain, and awkward, think of agaricus. Movements are exaggerated, uncertain, and awkward, think of agaricus. So in the Phatak Materia Medica, agaricus is a poisonous mushroom remedy which has very strong action on cerebrospinal axis. This remedy mainly acts on brain, spinal cord, medulla, and peripheral nerve, but not in a simple way. It distributes the coordination, not strength. It distributes the coordination, not a strength. It is an most important point of this remedy is disturbs coordination, not strength. Coordination is disturbed, strength is maintained. So agaricus patients have power but no control. These agaricus patients have power but no control. So if you want to describe agaricus in a few words, that loss of coordination with exaggerated, irregular, and uncertain movements. So loss of coordination with exaggerated, irregular, and uncertain movements. This is not paralysis, this is not true weakness, this is a overreaction of the nerve. This is a overreaction of the nerve and poor regulation of the movements. So movements become awkward, ungainly, too much or too little, or mistimed. These movements are awkward, too much or too little, or mistimed. So agaricus is the remedy for bad coordination, not bad muscle. There is no muscular weakness, muscle is good, but coordination is lost. So how this patient lives or moves? Agaricus patients wants to do things properly, but body does not obey accurately. He wants all things properly, but his body does not obey his command. They reach too far, step too high, drop objects, knock things over. Means if he want to touch the mobile, he go away. He want to walk, step is too high. So these are the their body does not obey their command. So these patient may say to us that doctor, my hand goes beyond the object, doctor, my leg does not move where I want. So mind commands correctly, body execute wrongly. So main things is that mind commands correctly but body execute wrongly. So nervous system is the main core or heart action of the agaricus. If you clearly understand the nervous system of agaricus, you can be very confidently prescribe agaricus. So this remedy is full of movement phenomenon: trembling, twitching, jerking, fibular spasm. Most affected parts are eyelids, face, tongue, and fingers. These trembling, twitching, jerking movements are mostly affected in face, eyelid, tongue, and fingers. So characteristics of these agaricus is one of the main characteristics that symptoms appear diagonally. Means right arm is affected, left leg is then affected. So the symptoms appear diagonally. Diagonal involvement strong suggests that central coordination is disorder. So diagonal coordination lost is the due to the central loss of the central coordination disorder. Then another characteristic is twitching and spasm, which is very important. Agaricus twitching is painful, sometimes involuntary, wandering, and visible. So common complaints patient may say that my eyelids keeps jumping, my face twitches when I am tired. Twitching ceases during sleep. This is another uncommon peculiar characteristic symptoms of agaricus is twitching ceases during sleep or uncontrolled movements ceases during sleep. This tells that functional nervous disorder, not a nervous disorder. This is a bold statement I am making that agaricus is useful in mainly functional nervous disorder more than structural disorder. If symptoms stops in sleep, think of nervous control, not issue with the disease. Another characteristic aspect of agaricus is chorea and convulsion states. Agaricus is very important remedy for the chorea. The key feature, as I already told you, that chorea better during sleep. This is the differentiating point from the many other remedies. Also, see in epilepsy and convulsive disorders. During convulsion, physical strength increases. Patient may lift heavy objects. So, this is one of the characteristic symptoms while prescribing the in epilepsy or convulsive patient relative or patient says that my strength is increased during the state. Strength is increased, maybe he lift heavy objects. So strength is present, control is absent. Peculiar sensations that presents in the agaricus is patient as if pierced by cold needles or hot needles, as if cold drops fall on the body, or as if cold weight lies on the parts. So painful twitching followed by stiffness and coldness is the another core we can find in the agaricus. Painful twitching followed by stiffness and coldness. This sensation may help us to confirm the prescription. So we can see now the modalities that common confirmatory modalities for the agaricus is aggravation by cold air, freezing air before thunderstorm, mental exhaustion, caution, alcohol, pressure on the spine, touch, morning, during menses, sun, and fright. So cold air, freezing air before thunderstorm, mental exhaustion, these are main aggravating factors, and ameliorating factor is gentle motion as of in the Rustox. So cold aggravation, twitching, and awkward movements is the agaricus. Some of the common uncommon mental symptoms of agaricus that agaricus is not an anxious remedy. His mental symptoms may include loquacity, talking incoherently, rapid changes of the topics, singing, making verses, fearlessness, also in some time indifferent, dull, dizzy as if drunk, awkward, clumsy. In agaricus, mind and body both lost their rhythm. Now in children's complaints, we may see that this is the very good area to prescribe children's especially in the CP children's or autistic children's, that the children have late learning to walk, late learning to talk, appear clumsy, learn slowly, not dull mentally, just poorly coordination. Their mental ability is intact, but their coordination is lost, often mistaken as lazy or stupidity. So in clinical picture, we may see that in the children that late walking, clumsiness, twitching, think of agaricus. Yawing is the one of the clue to enter the prescribing point of the agaricus. Frequent yawing before complaints, before spasm, before epilepsy, or before any complaints, you may see that frequent yawing. Yawing followed by involuntary laughter. This shows that the brainstem involvement. So, which pathological condition we may prescribe agaricus is that functional movement disorder, tic disorder, chorea, Turnit-like syndrome, cerebellar coordination issues, post-epileptic movement problems. It's a remedy for functional, not a degenerative disorder. So when nerves overreacted and movements lose their order of coordination, not strength, in the disease, it's a agaricus. So now we can see the peculiar symptoms of the particular symptoms of the agaricus. In head section, uh, typically head picture is the vertigo from sunlight, dull headache, head must be moved to and fro, head is constant in motion. So headache is relieved by after stool and urination. This tells us that the functional coordination, not the regulation problem. Pain in the head as if nail is driven into the right side of the head. So relief from the stool and motion. In functional nervous headaches, we can think of agaricus. So in eye complaints, movement disorder visible. So reading difficult because of the letter moves. Type seems to be swim. Double vision, oscillating eyeballs, twitching of the eyelids, nystagmus, squint, narrowing of the space between eyelids. These are the common eye symptoms. So patient may say you that, doctor, when I read the letters don't stay still, it like a running letter or letters is moving. So eye muscles are strong but coordination is faulty. In ear complaints, itching in the ear, redness and burning, sensation as if ears are frozen, twitching of the muscles of the around the ears, noises in the ears. Then cold sensation in the ears is the strong indication of the agaricus. In nose symptoms, functional disorders of the nose, frequent sneezing without coryza, flow of clear watery without cold, sneezing after coughing, fetid dark bloody discharges if it's excess in old people. In face symptoms, characteristic indication is face twitching, grimaces, cold needles as if pressed. Face gives classical picture expression of the agaricus as the facial muscles twitch, grimaces, idiotic or foolish explanation, face is blue and puffed. Sensation as if sphincters in the cheeks, as if cold needles run through the nerves, burning and itching. So facial twitching, cold sensation, odd sensation is the agaricus for the facial symptoms. Also in mouth and speech, angle of the mouth is dropped, partial paralysis, saliva runs out, herbs of the lips, offensive breath, tongue is dry, tremulous, one side is numbness of the tongue trembles when protruded, speech indistinct, jerky and stammering. Patient may say that, or in child's parents may told you that, doctor, my words come out broken, this fine motor central control is lost, speech becomes jerky. Throat symptoms, we may think of that feeling of contraction in the throat, dryness in the throat, difficulty while swallowing. So one of the characteristics sensation of the agaricus is small solid balls of the phlegm are thrown up without coughing. This is a peculiar symptom important for confirmation. Small Solid balls of the phlegm are thrown up without coughing. In stomach symptoms, it is a nervous stomach symptoms, not inflammatory. Always thirsty, irritation tastes like apples or rotten egg, irritation alternating with hiccups, sensation of the lumps in the epigastrium. Vomiting bitter with great prostration as if Aethusia synapium, with stitching pains in the rectum and groins. So digestive symptoms worse with nervous exhaustion. In abdominal symptoms, rumbling and fulminating, profuse flatus offensive, flatus is hot, diarrhea, foul smelling diarrhea, green grass, solid stools in the children, stitching pain in the splenic lesion, especially of the runners. So, often agaricus is seen in athletes with the coordination or GIT issues. Urinary symptoms, profuse urination, clear lemon colored, cold urine, frequent urination, urine flows slowly or in drops, has to press urine, press to pass the urine. Again, control problem, not obstruction. In sexual fear, overstimulation leads to exhaustion. Very important but ignored. Sexual desire is increased, premature ejaculation, palpitation during caution, profuse sweat after caution, general weakness afterward. In female sexual system, sexual excitement, bearing down pain, especially after menopause, menses too profuse, complaints after caution or parturition. So in heart and chest complaints, palpitation during caution, irregular tremulous palpitation, burning and stitching pain in the left scapula, angina like pain from the nervous origin. Palpitation may improve with tobacco is this strong characteristic symptom. Patient may say that I have when I have palpitation, I eat tobacco and I feel better, especially in the female patient. Spine and back extremely sensitive. Spine sensitive to pressure, touch, single vertebra may be painful. Other sensations are shooting and burning along the spine, formication, as if cold air spread along the back. So spinal hypersensitivity and twitching may confirm the prescription of agaricus. Extremity clumsiness is the characteristic. Extremity show in extremity upper limb hand trembling, burning and itching as if frozen, right hand unsteady while writing, fingers fly spasmodically, in lower limb uncertain gait. In gait problem, you must firstly think of agaricus. Legs feel heavy, numb and crossing the legs, cramps in the soles. So very striking and uncommon is the feeling as if limbs are not belonging to the patient. In skin, burning and itching, redness and swelling, as if frozen, chilblains, angioneurotic edema. Agaricus is one of the good remedy for chilblains. Itching changes the place on scratching. Also, slight blow causes the ecchymosis. Slight trauma causes the ecchymosis. In sleep, frequent yawing before complaints, as if it is a characteristic. Yawing followed by involuntary laughter. This is also one of the characteristic of agaricus. Starts and twitch on falling sleep. Night sweat, sweats on alternating side. Chorea symptoms better during sleeps. Twitching stops during sleep. Agaricus is the precious remedy. Small mistake, big failure. So prescription totality for the agaricus in the patient, we may think of first is the nervous picture. In nervous system, trembling, twitching, jerking. In moment error, second point is moment error is awkwardness, clumpiness, reaches too far or too long, drop sting, steps too high. Score of control features, strength is present, coordination is absent. Modality, core of the modalities, worse from cold, worse from mental exhaustion, worse from caution, better by gentle motion, twitching stop during sleep. So strength without control is the key of agaricus. So common remedies to we need to differentiate from agaricus is the first remedy is the china. So common symptoms confused in the children: irritable, cross. China has irritability, cross, worm related symptoms, sudden jerks from irritation, child is angry and violent. While in agaricus, awkwardness, clumsiness, twitching from nervous miscontrol, child is silly, laughing and indifferent. So key differentiation is China jerks from irritation. China has jerks from irritation due to the worms. Agaricus jerks from the poor coordination. Another remedy is the agaricus and tarantula hispanica. Both are hyperactive remedies, but tarantula have extreme restlessness, dancing, running, needs music, purposeful rapid movement. It is a purposeful rapid movement, while agaricus has movements as unskilled, awkward, uncertain, too much or too little movement. So tarantula moves too fast but accurately, agaricus moves wrongly. Another remedy is for we need to differentiate in between these two remedies is agaricus with physostigma. Both have affection of the nervous system, but physostigma have muscular weakness, paralysis and spinal depression, while agaricus has strength is preserved, not to paralysis, not to true paralysis, loss of coordination. So weak muscle, physostigma; strong muscle and weak movement, agaricus. Then another remedy we must differentiate is agaricus versus tuberculinum. So both have restlessness and nervous symptoms, but tuberculinum is dissatisfied, changeable, destructive, strong emotional drive. Agaricus is silly, clumsy, awkward, neurological, nor emotional. Tuberculinum's mind is restless. Agaricus is disorders of the nerve. So these common remedies. Then in Phatak, he gave in his relationship is that complementary remedy is the calcarea cap. So after first prescription of agaricus, we may complement with the calcarea cap. So agaricus handles the functional nervous miscoordination, while calcarea builds the structural and constitutional strength. So clinical sequelae: the child with clumsiness, twitching, give agaricus. After improvement, constitutional weakness, we can give calcarea cap. So calcarea cap corrects the control and agaricus corrects the control and calcarea builds stability. Another related remedy given by Dr. Phatak is physostigma, paralysis side of this agaricus, contradiction side, and tuberculum is diathesis behind the nervous instability. So another point we must discuss is the potency selection. In many cases of the CP child or in the movement disorder or chorea, I use mainly 30 and 200 with all characteristic. I may use 1m, but it is very rarely in infrequent doses. So when do agaricus must not be prescribed or mistaken while prescribing is when there is true paralysis, there is muscular wasting, this muscle strength is gone. Agaricus has strong muscle. In structural CNS damage, in structural disease of central nervous system or brain, as if their MRI shows any structural changes. Twitching is poorly anxiety based. In agaricus is the coordination based, and if the twitching is due to the anxiety. Then in another symptom of clumpiness is due to the joint diseases. It is in agaricus, it is due to the central nervous system disease. So if there is strength is lost, agaricus is not indicated. So which type of patient in their today's practice we need to prescribe agaricus or think of agaricus, uh, or we may commonly see in day-to-day practice, or common versions that patient we may see that it is a patient drops objects frequently, then eyelids twitch constantly, walks awkwardly. These are the observations that we may see in day-to-day practice. Patients feels that cold needles in the thumbs, aggravation from cold air, better from gentle motion, twitching stop during sleep. This is the common picture we may see that. So core or highlight or essence of the agaricus, or how to remember in 5 to 6 words, is the system. Which system affected? Central nervous system. Problem: loss of coordination. Power: preserved. Control: disturbed. Keynote: twitching, clumpiness and cold needle sensation. And modalities: worse from cold, better from gentle motion, and better from sleep. So agaricus says that when strength is preserved but movements go wrong, this is disease of lies in the coordination. So this is all about agaricus. Thank you for patience listening. Thank you very much.